Leukemia is a type of cancer that affects the blood and bone marrow, leading to the abnormal production of white blood cells. There are several types of leukemia, each characterized by the specific type of white blood cell affected and the rate of disease progression. Understanding the different types of leukemia is crucial for diagnosis, treatment, and management. In this short video to supplement your learning, we will explore the four main types of leukemia: acute lymphoblastic leukemia, ALL, acute myeloid leukemia, AML, chronic lymphocytic leukemia, CLL, and chronic myeloid leukemia, CML. Acute lymphoblastic leukemia, ALL, is the most common type of leukemia in children, although it can occur in adults as well. It affects lymphoid cells, which are responsible for producing lymphocytes, a type of white blood cell. ALL progresses rapidly and requires immediate treatment. Symptoms may include fatigue, frequent infections, easy bruising, and bone pain. Treatment typically involves chemotherapy, radiation therapy, and sometimes stem cell transplantation. Acute myeloid leukemia, AML, affects myeloid cells, which give rise to red blood cells, platelets, and certain types of white blood cells. It can occur in both children and adults. AML progresses rapidly, and symptoms may include fatigue, shortness of breath, frequent infections, and abnormal bleeding. Treatment for AML involves chemotherapy, targeted therapy, bone marrow transplantation, and sometimes radiation therapy. Chronic lymphocytic leukemia, CLL, is a slow-progressing leukemia that primarily affects older adults. It involves the overproduction of mature but abnormal lymphocytes. Many people with CLL may not exhibit symptoms in the early stages. When symptoms do occur, they may include fatigue, swollen lymph nodes, recurrent infections, and weight loss. Treatment for CLL depends on the stage and may involve watchful waiting, chemotherapy, targeted therapy, immunotherapy, or stem cell transplantation. Chronic myeloid leukemia, CML, is a type of leukemia that affects the myeloid cells and is often associated with a genetic abnormality called the Philadelphia chromosome. It usually progresses slowly, with three distinct phases: chronic phase, accelerated phase, and blast crisis. Symptoms may include fatigue, abdominal pain, enlarged spleen, and unexplained weight loss. Treatment options for CML include targeted therapy, chemotherapy, immunotherapy, and stem cell transplantation. Hairy cell leukemia, HCL, is a rare and distinct subtype of leukemia that accounts for only a small percentage of all cases. It is characterized by abnormal B lymphocytes, which appear hairy under a microscope due to fine projections on their surface. These abnormal cells accumulate in the bone marrow, spleen, and blood, leading to various symptoms and complications. HCL primarily affects middle-aged and older adults, with men being more commonly affected than women. Symptoms of HCL may include fatigue, weakness, frequent infections, enlarged spleen, and low blood counts. Unlike other types of leukemia, HCL progresses slowly, and treatment options have significantly improved over the years. The mainstay of treatment for HCL is targeted therapy, specifically a drug called cladribine, which has shown excellent response rates. In some cases, splenectomy, surgical removal of the spleen, may be considered. With early diagnosis and appropriate treatment, individuals with hairy cell leukemia can achieve long-term remission and lead fulfilling lives. In conclusion, leukemia encompasses a range of diseases affecting the blood and bone marrow. The four main types of leukemia are acute lymphoblastic leukemia, ALL, acute myeloid leukemia, AML, chronic lymphocytic leukemia, CLL, and chronic myeloid leukemia, CML. Each type has its own characteristics, progression rates, and treatment options. Early diagnosis, proper medical intervention, and ongoing management are crucial in improving outcomes for individuals affected by leukemia.